but just make sure you're prepared, because once you get the rhythm of it, the volume starts coming.
Hey, Dr. Jed, I am super excited to be doing your Two Common Club interview for doing over $1 million in dental implant revenue with us. How's everything going?
Very good. Thanks for having me today. No, it's good to hit the comma club. That is nice. We like those. Get two in there.
Absolutely. Let's get on to the next one. Tell me and tell everybody who's going to watch this. Tell us about your background. I love just to understand, what kind of attracted you to dentistry in the first place. Give me the history.
Sure. So definitely the attractiveness was at least initially using some. I really do like art, so I like to be able to either painting or creating through clay work. Those kind of things were always of an interest to me. So the cosmetics of dentistry was always something that really brought me a little bit closer to enjoying that aspect of it. In addition to us being able to help people, overcome. Like my grandfather was one of the bigger advocates for me to getting into dental implants, because he was a 80-year-old who'd been wearing a upper and lower denture and had to soak his donuts in milk every day to be able to eat stuff because he couldn't. So therefore, that's what really kicked me off to do the implant stuff. And from there, just being able to see people's lives, changed. People say that, oh, implants is cosmetic work, so it doesn't have an impact on people's lives. But when you take these people who have closed themselves off socially because they're embarrassed about their teeth and their smile, or being able to, eat food off of a menu that they want to eat more, they choose what they can eat. When you give them those tools back, it pays dividends over and over for their physical life, but also their social life, and being able to, again, reintroduce themselves back to society. So it's great.
Yeah, I love that. And you said change their lives, right? I love that transformation. Yeah, being able to just help a patient, right? I mean, there is nothing, no one loves going to the dentist, no one loves the drill and fill, right? But being able to give somebody a new smile, it's amazing. So where did you go to dental school? And then what was your path like from dental school to, you mentioned that you had an interest in your grandfather kind of pushed that interest into the implant space, but tell me a little bit about the path from dental school to actually placing your first implants and doing a lot of volume now.
Yeah. So it started University of Medicine and Dentistry of New Jersey, which is now Rutgers Dental School, is where we started. One thing that changed my course of action, I had been interested in getting into maybe at least applying to oral surgery residencies or doing periodontics, but I ended up meeting my wonderful wife, who is also a dentist who works with me. And so paths changed a little bit. So I did have to, once I graduated, as you mentioned, like, well, how did I get there? I was a little bit more aggressive in finding places to get the education to be able to place implants. So start off with like a mini implant residency to get at least kind of get inside the, in the door. From there, it was a little trickier to find places that would train a general dentist like openly. So therefore, it took me a while. It took me probably about 2.5 years to finally find, I went through a couple of John Russo courses where we did a lot of cadaver work. In addition to the Augusta University, I know Steve Pruitt pretty well down there, but they did an advanced implant placement and sedation. So I got my IV sedation, and like we did probably hundreds of implants within like 2 weeks. I literally spent 14 days straight with them, and we just went to it. So after that, I felt much more comfortable really applying this in my own practice. So in between then, like I said, that's where we started really being able to do more volume. The last component is that essentially once I got the education, there was a company where I almost taught for about 10 years training general dentists how to do it. We essentially took all those weird educations that you had to go across the nation to get, put them in at least one place, and then therefore save people years of trying to find the path and be able to move forward.
I love that. And you mentioned something there, which was the sedation part of the training that you did. From your perspective, how important is it? I talk to dentists all the time, and this is a question that comes up all the time. How important is it, in your opinion, to be able to offer sedation versus, topical or something else, gas?
Sure. So I think when it comes to when we're meeting these patients, especially through the DIM process, you got to almost process it like they're trying to feel you out as a person and who you are. And literally you have just a few minutes to convey comfort and confidence from the patient into you, into what we're trying to offer. So for me, being able to kind of offer the sedation part, I think they just need to hear that they do offer it. And now I would prefer that they did it, because for like edentulous cases, then you could work your way around it clinically, but you're trying to overcome the hindrances or the roadblocks from the patient. And the sedation to me is key to have the option of, and I would say probably more than 90, probably 95% of our cases are all sedation. because generally now that we're seeing patients with more complex needs, post meth addiction, or, just again, putting their family's needs ahead of themselves, when you have to do a lot of tooth extractions and ridge augmentation, I think it's just an overall better experience that they kind of wake up and have the new smile and not have to hear the noises and sounds. There's only been a few, like I said, a few men who were edentulous that are like, oh, it doesn't really bother me. I still think having the sedation, definitely something more than oral or nitrous, you got to have at least the option to offer that, hands down.
I love that. And having had some extractions myself and some not done with IV sedation, the pain is gone. So I wasn't in pain, but just the pressure, that torque, right? It's when you're pulling out especially a wisdom tooth, there's a lot of pressure, a lot of torque that has to be applied. So anyways, I wanted to ask that question because it's something that I get asked all the time. Okay, so going into your current practice and what you're doing now and the growth that you've been on, how has that looked from just, take me back maybe, I don't know, take me back a couple of years ago, and then what that growth has looked like since obviously starting to work with us and what we've done on our side with our calling and our virtual consults for you.
Yeah, so I say prior to, like, again, if we're going to take the time machine back, essentially at that point, we were probably at 18 to 20 arches. The difficulty is that we had to see a lot more bigger volume because there wasn't the advantage of what DIM is offering through the virtual consultations. So for me, there was a lot of times where we would have to schedule quite a few patients to get down to even getting a qualified candidate, which we didn't always also know prior to. So you would go, I would do the spiel, talk for 30, 40 minutes. It was the best that we could do at that point without like I said, the organization of DIM. But there was a lot of time spent with a little bit of gain. So we had to see hundreds and hundreds of patients to get those qualified 18 patients, even though we had many in between. But if we would have had the virtual consultation option back then, I would have saved probably hundreds of clinical hours doing these consultations because they just didn't have the finances at that time. So with them, it's really that's been the biggest improvement is essentially once we're getting through the meeting with the virtual presenter, these patients are educated and I don't really have to talk too much. It's more of just saying, hey, yeah, you're definitely a candidate. You think I'm a good fit for you and you for me, then let's go. And then we've got people upstairs who will get you the money that you need. That to me, that 10-minute change has really changed the full dynamic. So I'm not like completely fatigued from the talking and the emotional experiences 45 minutes every time. Like I get to know them, tell them they're a candidate versus having to give them the whole process from a single implant to full arch stuff or snap on. They've kind of got most of the education already.
Yeah, and that's something I want to expand on what that actually looks like because it's not a service that a lot of offices use, but it's a service that works really really well. Where not only will we do the setting, which is pretty standard, right? I think there's a lot of people that can do setting, but in addition to the setting, if we need it, well, we'll do that virtual where we'll just like you said, we're pre-selling them on you, on the office, on implants, making sure that they're qualified, and then we schedule them so they have an hour long consult with us, and then we schedule them directly to your office. And I know that your guys' close rate on the ones that we're scheduling is, it's very, very high, right?
Yes, and that's good, and that's how we want it. Like I said, and patients want to be notified. They want to have things explained to them and have their expectations met. And that's definitely where I feel like DIM separates themselves from other companies because these patients are aware coming in, which is great. It's great for us.
How has the structure of your team changed since before you were working with us to now? Have you needed to add any more people? Have you scaled up anybody, or have you been able to keep basically the same structure because of all that backside support we've been doing?
Yeah, so with the backside support, as far as like front desk staff or those kind of things, we haven't really had to change much. The good part is because we're scheduling so many surgeries, now the actual, hands-on people, the dental assistants and, making sure our nurse anesthetists or anesthesia, we make sure we have everybody on board, but that's the direct reimbursement for actually closing the cases. So we're able to really utilize it a high percentage and we're still positioned for a little bit even more growth from what we've got now. But as far as the clinical staff goes, that's the best part because you don't really need to hire more auxiliary staff locally because DIM is doing a fair amount of that, getting us squared up. And I can still use the same staff that I have with just some minor training in between to get them to understand okay, here's our lenders and this is how we get them the financing. But it's been really a nice, smooth transition.
Yeah, I love that. And it's that type of scaling, it's a good scaling problem to have, right? Where you have volume, you have revenue coming in the door. You only are scaling because you're making money and you just need to fulfill the service, right? Which is that's a great problem to have. if an office was looking at DIM and debating on, whether they wanted to move forward with DIM or they just are starting in the dental implant space, what would be your recommendation to them if they were contemplating partnering with DIM?
Yeah, I think I would say there's two sides of that coin is regardless of what they're using now. Like I said, we probably spent maybe $1 million prior to the 10 years prior to getting into DIM, and we kind of tried just about every avenue, and we haven't found anything like DIM up until this point. And so they've really, like I said, your office is what you're offering is really putting a lot of pieces together under one roof, which makes it easy for communication and for organization's sake. I'd say the bad news is if you don't feel like you're ready for a ton of arches, be careful because they're coming. So it's kind of like it's a double-edged sword. Like you're going to get what you asked for, but just make sure you're prepared because once you get the rhythm of it, the volume starts coming. So yeah, make sure you feel like, yeah, you're ready for some arches, then sign up.
Yeah, I love that. That's definitely a double-edged sword on that for sure. All right, I have to ask. I want you to share, and I think this is so important. I love talking about the money. I love talking about what we can do from a revenue and financial standpoint, but I always like to bring it back to the patients. So I would love for you to share a smile transformation that has stuck with you, whether it was one that you recently did or one that you did a long time ago. Tell me about a smile transformation that you've done that's just really stuck with you, that really just speaks to the volumes of this type of dentistry.
Yeah, I would say probably, let's see, thinking off the top of my head, it's becoming, because now with them, the other part of the process is that we want to capture these on video. So it's not uncommon to see the tears, the patient getting choked up, the family members, like literally they're in awe. They can't even comment because of like I said, it's such a change to them. I would say probably the one of the biggest one we had a patient who was the foster mother of 23 children. 23. So you can imagine she had been putting off her own kind of health and care for, I mean, decades, decades. And so I think that was probably one of the ones that sticks out because at that point, her husband had passed away. I think her last two children were kind of maybe in their early teens. And it was a point where like she just needed to do something to improve her own quality of life because now she was just really kind of stuck in this again, prevented from being social at all. And so she knew that one of her older daughters, who was about to get married, and they were all kind of like they all got together to help her do this. And so that one to me was like it's because it's something about like the love of your own children trying to take care of you, understanding the value that you put their needs before yours, and seeing that kind of come full circle, and then getting to see the wedding photos of the final restorations. Like I said, it was just I mean, this much to the point where she would have never even taken pictures with the family for decades. If not, it was closed lip, or she would turn away, not look directly at the camera. So yeah, I think that was probably one of the most heartwarming ones because it was such a family effort.
I love that. These patients, they don't, it's not that they're bad people. It's not that they are, some of them it's genetic issues, right? Some of them, I mean, there's so many reasons that they could be in the situation that they're in. And even from a financial standpoint, it's like for her, she's been taking care of these foster kids for a very long time, which I can appreciate. I come from a really large family myself, and so I understand what that's like, right? I understand a mother that puts her needs behind all the kids, and man, that's awesome. That's really cool that that her kids could help her out and be able to transform her life. And really, you said something there that I just want to reemphasize. She didn't come in because she wanted new teeth, right? She came in because she wanted that outcome of being able to smile, being able to not be ashamed of that smile, especially at her daughter's wedding. So, and you were able to help transform her life with that. So, man, I love that. I appreciate you sharing that story with me. That's a really powerful and really cool story. So, well, awesome, Dr. Jed. It was great talking with you. Great doing this interview. Before we jump off, any parting wisdom that if a doctor is, going through the process wherever they're at, any parting wisdom that you might share with a younger doctor that maybe isn't doing the level which you're doing, what would you recommend for them? Just words of encouragement or something along those lines?
Sure. No, I definitely think as an educator, I think it all falls along the line of patients can recognize when you're confident in what you're offering for treatment. So if you find yourself and you're having a hard time, presenting cases over $10,000, then you need to find somewhere to get the confidence through either hands-on training or cadaver training. Like there is a value to that. And even myself, I still am having to be open to learning new things. Okay, and so that's a big one. So you got to be open to new things. In addition to, as like I said, that find there's so much education out there now to help you overcome the hurdle that would prevent you from doing it. And now you can just a click away from the internet, you can find these programs. So by all means, get trained enough to feel confident. But like I said, as far as any other ways to get the amount of qualified patients in your chair to provide the treatment that you want and you want to do, so far DIM really hasn't had any other counterpart that's been able to compare to what it's done for our office. So
I appreciate that, and I appreciate those words of wisdom that you shared. And hey, I look forward to doing another Two Comma Club interview with you.
maybe a triple comma. Do we have any triple commas yet? Well, let's work on that one.
Yeah, yeah, absolutely. Let's keep going and growing and scaling this for you. I love that.
All right.
I appreciate it,
Thank you
Dr.
so
J.
much.